As a parent or caregiver, our worst fears come to life when our children are hurt or severely injured. Imagine walking into the room and finding your child barely breathing, gasping for air, or even worse, unresponsive. EverydayHealth.com says 359,400 Americans experience a cardiac event outside the hospital every year. Of these victims, people that receive bystander CPR are twice and even 3 times as likely to still be alive within 30 days after their cardiac event. The Child Development Institute states near drownings, accidents, suffocations, poisoning, smoke inhalation, electrocution injuries, and sudden infant death syndrome are all reasons parents should know CPR. Yet, as a new parent, CPR wasn't something I had to learn before I could leave the hospital with my baby. There are several tasks to initiating CPR and determining if your child does need CPR. The first one is to check your scene safety. You have to make sure your scene is safe to enter. If there's a car accident or an electrocution injury or things like that, your safety is important because you can't provide care if you're hurt too. Your second step is to check responsiveness, and we'll go into a little bit more detail later. Your third step is to activate the emergency response team, then initiate bystander CPR, and then reassess after 2 minutes. First, checking responsiveness includes things such as airway, breathing, and circulation, or referred to ABCs. The American Heart Association says that people that need CPR are people without a pulse and with no breathing or very inadequate breathing. It's important to react quickly in these types of situations. Your ABCs are something you can check when you're surveying your scene. You can typically tell if your child is breathing or if they're not. The circulation, you're going to check that by checking the pulse. You want to do all of this within 10 seconds. American Heart Association states that all of these things can be done simultaneously once you get close. Look, listen, and feel. Those are the big things. Look at your child, check their chest rise, listen to see if they're breathing, and feel for a pulse. If you can't find all of those things within 10 seconds, you need to alert the emergency response team. Alerting the emergency response team just means to call 911. You can do it, you can have a bystander do it. If you do it, it's good to put them on speakerphone and initiate CPR while you're speaking to the dispatching unit. If there's a bystander or more people, you can have somebody else do it while you initiate CPR. Remember that bystander CPR doubles and triples chances of survival. To initiate CPR, we're going to go over here and look at this. For both children and infants, you need to make sure they're on a hard, flat surface. Couches, beds, things like that, they're not good for adequate CPR because as you push down, your child will sink as well, and then you're not getting adequate depth. You start compressions. With infants, you can use the 2-finger method. You place it in between their nipples on the breastbone, and you need to push at a depth at 1.5 inches at a rate of 100 beats per minute. For children, you can use the palm of your hands. You need to lock your elbows because this will keep you from bending your elbows as you're doing compressions. Same thing, you need to place in between the nipples. The depth is a little bit deeper. It's 2 inches for children above the age of 1 to the adolescent age. And you still need to push at a rate of at least 100 beats per minute. Once you start your compressions, your rate is, if you're doing it by yourself, is 30 compressions to 2 breaths. If you have 2-person CPR, if someone's helping you, you do 15 compressions and then you give 2 breaths. And the way you give 2 breaths is you just tilt their head and make sure that their airway passages are open and you blow into their mouth. With kids and infants, it's really, really important to remember that their lungs are smaller. So you don't want to give them a full adult breath because you could overexpand their lungs and even burst them. Something I forgot was the depth is really important because if you push too hard, you can break the sternum and you can cause further injury. After 2 minutes of doing CPR, you need to reassess the ABCs, the airway, breathing, and circulation. Your interruptions for compressions and breaths need to be no longer than 10 seconds. So when you're stopping after 30 compressions to give the 2 breaths, they need to happen fairly quickly, and you need to check to make sure that the chest is rising and falling. After all the compressions, you need to make sure that the chest recoils completely. That way it gives adequate compressions. If after 2 minutes there's still no pulse, no breathing, and there's no improvement, you need to continue CPR until help arrives. If your child is responsive, then obviously you would discontinue CPR. In closing, I'd like to reiterate the fact that bystander CPR initiated within 2 minutes saves lives. Remember your steps, check the scene, check responsiveness, call 911, initiate bystander CPR, and reassess if help still isn't there. It's really important to also remember your depth, 1.5 inches for infants under the age of 1, 2 inches for children ages 1 to adolescent. And it's also really important to remember your rates, 30 compression to 2 if you're doing single person CPR, 50 compressions to 2 breaths if you have help. Compressions are exhausting. From my personal experience, if you get tired, switch. If you don't think you can do this alone, get help. Make sure there's other people around that can help you. Even your neighbors, you can knock on the door or call them. But if you think it'll be a long time before you'll have emergency services, ask for help. Typically after 1 cycle of CPR, you're exhausted from doing compressions. Care.com states that classes are short and easy to find. Use your resources, contact the hospital, contact your EMS station. A lot of times the EMS in our community has CPR classes that you can sign up for at no cost. The American Red Cross and the American Heart Association websites also have more info on classes as well as recertifications. It's recommended that if you do become CPR certified, you get certified every 2 years. And the AAH or American Heart Association guidelines that I've used today, those are all open to the public and accessible on the American Heart Association website. Thank you.
You did much better.